Hi, my name is Leah and this is Joe, and we'll be providing you information on your new oral anti-cancer medication known as Abiraterone Acetate. This medication is for your prostate cancer metastatic castration-resistant form. The brand name is Zytiga, and it works by inhibiting CYP17.
So let's go over proper dosing and administration. You're going to take 1,000 milligrams once daily, but more specifically, 2 500 milligrams tablets a day swallowed whole. You're going to take this medication on an empty stomach, which means at least 1 hour before or 2 hours after food. It's very important to administer this on an empty stomach because food could increase the absorption up to 10 times and cause toxicities, which we want to avoid. It is also important to note that this medication needs to be swallowed whole and cannot be chewed or crushed.
In combination with your Zytiga, you're going to take prednisone 5 milligrams twice daily, which will help manage some side effects that we'll get into a little bit later. For proper storage and handling, you want to store at room temperature and make sure to wash your hands before and after administering this medication. If a spouse or another individual takes care of you and administers your medication, you want to make sure if they are pregnant or could be pregnant that they wear gloves to avoid the hazardous toxicity of this medication.
So common adverse drug reactions and how we can handle them. So very common, hot flashes. It's a heat loss response or a sensation of warmth spreading throughout the body. There are ways to handle this, and there's non-pharmacologic and pharmacologic. A non-pharmacologic treatment would be meditation or slow deep breathing, and a pharmacologic could be venlafaxine, which will reduce the number and intensity of hot flashes.
Another common side effect is night sweats. You want to handle this by sleeping with a light comforter, light clothing, and a fan close by.
And another common adverse effect, insomnia. You want to limit coffee before bed, limit your screen time before bed. You want to lie down only when you're sleepy, and possibility of over-the-counter melatonin.
You could also experience tachycardia and palpitations. If you do, we will screen for hypertension and cardiovascular disease and go from there. You could also experience anxiety and panic. You want to handle this by psychotherapy, mindfulness, correct breathing, and exercise.
There's also an increased risk with alcohol intake, so you want to limit alcohol intake to only social occasions or limit to none. You can also experience sexual changes, so you could seek sexual health counseling, phosphodiesterase type 5 inhibitors possibly, and the use of mechanical devices.
Another common side effect is loss of muscle mass and fatigue. We want to encourage you to do regular exercise. So we'd recommend 5 times a week in at least 30 minutes, but try to get up to an hour. We also could have metabolic, which would be a risk for diabetes, which we will screen for and go from there. If any of these symptoms become consistent or severe, call your doctor immediately.
So some warnings and precautions. Adrenal cortical insufficiency. We might increase the dose for prednisone. For hepatotoxicity, which will generally occur within the first 3 months. We want to observe that. And mineralocorticoid excess. And we want to monitor blood pressure and control the hypokalemia. That's a possible outcome.
There's also a warning on cardiovascular disease, which includes heart failure, myocardial infarction, and ventricular arrhythmias, which we'll look out for and screen. And we also want to look out for diabetes, since there could be severe hypoglycemia with thiazolidine diazones, which we may need to dose to dust if that happens.
Since there are many drug-drug interactions, make sure to speak to your doctor before starting any new medications, prescription or over-the-counter. And just to follow up and monitor, we want to look at PSA levels to ensure that the medication is working properly, liver function tests to manage toxicities that may be occurring. We want to do that every 2 weeks for 3 months. We want to observe potassium, blood pressure, fluid retention at baseline and monthly to ensure that the mineralocorticoid excess is not a problem, and glucose test monthly because of the adjunct prednisone.
I hope listening to us helped you get to know more about your medication. If you have any questions at all, don't hesitate to call your provider at any time. Communication is key to achieve your healthcare goals. Thank you for your attention, and goodbye.